everyone. I'm Craig Norman, and I want to welcome you to this Euclid-sponsored educational event that is regarding the ortho-k community. Today's topic is home alone, remotely managing patients, parents, staff, and myself. And we have two wonderful experts today to be able to discuss that with us. I'd like to introduce you first to Dr. Rob Gerowitz. Rob is from north of the Chicago area. I had the opportunity to meet Dr. Gerowitz first at the initial Global Ortho-Keratology Symposium in Toronto, where he was already involved with fitting children and adults with ortho-k lenses at that time in the early 2000s. He's an internationally recognized speaker in this area of ortho-keratology. And interestingly enough, he was also part of the SMART study, which was one of the landmark initial studies in the ortho-keratology field. He's received numerous awards, too many for us to really go through here today, and recognition. But I did want to mention last year in 2019, he, along with his two partners, started Mission Myopia Management, which is an educational format where they are taking it to different cities. Dr. Gerowitz, welcome.
Thank you very much, Craig. I appreciate it.
You bet. Not as much as we do. Thanks again, Rob. The second person I'd like to introduce you to today is Trevor Fosso. Dr. Fosso is from Minnesota. I've had the pleasure of knowing Trevor since my first week at joining the Michigan College of Optometry. When Trevor was there. Trevor went to school in Minnesota at Bethel University, then was at MCO, and then completed a residency at Davis Stewart in Wisconsin in contact lenses and anterior disease. Trevor not only specializes in orthokeratology, but in many different types of specialty contact lenses. Trevor, welcome.
Thanks, Craig.
So, fellas, let's go ahead and get started. You know, we're at this home alone thing where everybody's getting a little stir crazy. We've got a lot of things that are going on. We want to take care of our patients, the parents. We want to take care of our families, our staff. And so if I could start with Dr. Gerowitz, and I want to address this area of communication with patients, but in the area of ortho-k, it's really patients and parents. How is that going for you, Rob? And how do you communicate with both the patients and their parents today?
Well, the first thing I did is contacted all the patients that I had dispensed over the past 3 months. And I did that via email. And I just wanted to check in with them and make sure they were doing okay and let them know they could reach me if they had any questions. And I wanted them to know that if they had any issues at the early start of their program, that they could stop wearing their molds and we'd pick up the pieces after this is all over. And otherwise, we'll see them when we're back in the office.
Okay, that's great. So you started that communication right away?
Yes, sir.
And it seems to be doing okay. And Trevor Fosso, what about you?
Very similar. So, my more recent ortho-k fits that I was either working on or had just dispensed right before our clinic closed down. I communicated with mostly through email and just kind of let them know, if there are any issues to just kind of stop wearing their lenses at the moment. If they're doing well, kind of continue on with them. But that our office was open for emergencies. So if they had questions or concerns, those questions could get to me directly. I gave, they all have my personal work email, so they could just email me directly if they had any questions, which I check that fairly regularly. So,
okay, that's terrific. And Dr. Gerowitz, did you communicate directly with the patients, or is that something that you delegated to the staff, or was it a mixture of the two? How did that work?
Over the years, I've made it a practice of emailing my patients after every ortho-k visit or follow-up. And so they're used to hearing from me via email. So I did that personally. Okay.
That's actually a great communication tip long-term, not just for today. That follow-up touch. I think very often, just speaking for myself, you go to see a medical doctor, you forget about the visit a little bit, and within 24 hours, you hear from the office, and you're kind of surprised that how great is that they are actually communicating with me in that manner. So one of the things that comes up, Dr. Fosso, is that in this area of, offices not being open, not being able to get product to patients, did you work on spare pairs at all, trying to get spare pairs to the patients? And then the second part of that question is, if you had to replace lenses for a patient, how did you do that? Did it go direct to the patient, or did you come to the office, or how did that work out?
So we didn't run into that issue, or we haven't run into the issue yet where someone's broken a lens yet. I did communicate when in that first communication with patients that, I talked to them about getting a spare pair in case they wanted to, or that was an option in case they wanted to have a backup pair. Otherwise, I've been fairly fortunate in that I can get lenses turned around pretty quickly. Especially if we expedite them, usually, within the same week, I can get them to someone, and most of my patients are happy with that. And since I haven't run into the issue yet, my plan would be to just ship them straight to the patient, just so that they get to them quicker, as well as, just kind of limits that in-between step of, I don't necessarily have to handle them, and it just kind of limits the exposure of those lenses for the patient. So,
okay.
But we did get a few in the office that I had ordered right beforehand, and all those I put through a kind of a clear care cleaning process beforehand, and then we put them in their cases and have allowed patients to come and pick lenses up, kind of in a limited fashion, as they need to as well.
Great. And Rob Gerowitz, is your office handling it any different?
Slightly. During that first week, we did a lot of parking lot pickup where we didn't even have the patient come in the office. We went out to the parking lot, and like Trevor, we're doing a lot of direct shipment from Euclid directly to the patient. We're probably replacing, 4 or 5 different molds each week, and patients are appreciative of that.
So I'm a little curious regarding it, Rob, that prior to this whole COVID thing, did you routinely ship direct to the patients, or before that, did you just have them come into the office?
No, we always had them come into the office. We replace molds every year. And so once they've cleared that first year, they do have a backup set from the previous year. And we always like to see how the new pair fit, and then we dismiss them.
Okay. And just to build on that for just a second with you, you've referred to it now a couple of times as molds. Is that the terminology you like to use with patients when describing ortho-k lenses, so they can get a kind of picture what the function is of the lens for their eye?
Not just with patients, but in any of my lectures, because every night we remold the eye or reshape it. And in my opinion, lenses are a commodity, and I'd rather not see what happened to soft lenses happen to ortho-k designs.
Okay. That's a pretty good practice management tip, also in a way to be able to communicate that with patients. Trevor, you had mentioned before we went live today that your office is getting ready to open potentially around the 4th of May or so. Has that scheduling already started with patients and or their parents, or is that just kicking in now?
So we had already had our schedule fully booked for, we've got 5 providers in our office, and we typically have 2, 3, or 4 providers working at a time. And so all their schedules had been open, where we have patients scheduled every 20 minutes for each of us. But now we've switched that back so that there's only 2 providers each day. And so the schedules have kind of changed that way, our template has. And so now they're going to go through and switch those around so that the patients on the schedule fall into those needed time slots. And then we'll push out the other ones as we need to.
Okay, great. Rob, is that any different on your end? First of all, is it May 4th, the kind of the date for you guys, or is it pushed out even farther?
Not even close for us. We're on the outskirts of Chicago, which does have a number of cases, and a couple of the suburbs in my area are saying if you're out in public, you have to wear a mask. So I think we're going to be looking at at best the last Saturday of May, the first Wednesday of June, something like that. And we'll be scheduling, according to Richard Ham's recommendations, of 1 patient per hour.
Yeah, that's interesting. I know that Trevor had mentioned to me before, they're thinking about going from 20 to 40 minutes, for instance, in their office. And now you're talking about an hour. I had a conversation with somebody last week who was telling me that because of the backlog of patient visits, they were thinking of moving up their schedule and seeing people in less time, not more time. And I thought that was the craziest thing I'd ever heard of right now, because we don't even know what the new flow of patients is going to be exactly in the office. So if we could, Rob, I'd like to ask you, so you have staff, and it appears to me you have staff that works in your office and has been there for a while. How are you able to keep up staff morale in a time like this?
Well, I mean, their first concern is, are they going to have money now? Are they going to have a job later? And we've gotten them, since they were furloughed, put onto unemployment while we're waiting, like everybody else, for the PPP.
Mm-hmm.
And we've been doing Zoom meetings every 2 weeks. So our standard operating procedures that we talked about 2 weeks ago have changed this week, and they'll probably change in 2 more weeks.
Right.
But we're just trying to get all our ducks in the row so that we can make sure that if there's something going on, we're capable of handling it. And I want them to look at every patient like that patient does have COVID.
Yeah. Yeah. I mean, that's the wise way to look upon it. I think it's also very wise the way you're describing having these routine meetings online to still communicate with the staff. You could probably get a better sense for what the staff morale is in general if you can chat with them. So really, that kudos to you. I think that's terrific. And Trevor, anything different in your office?
Very similar. So the biggest difference is, so our office has received the PPP loan. So we've actually started back where our technical staff and kind of front office staff, billing and coding, everything like that, we are actually back working. So we were all on unemployment, myself included, because I'm an associate. And then last Thursday, they got approved for that. And so now we've all come back at our normal kind of hourly wages and such. And then that, so we're working a little bit now each day. There's a few of us in the office. And then starting on the 4th, that's when we'll roll back a little bit, even a little bit more, where there'll be about twice as many as what's in the office now. There's about 5 or 6 people in the office at a time right now. So.
Right. You know, that's such a crazy thing that you mentioned unemployment, that obviously as an associate, you're trying to work your way into the business relationship stuff in your office, but it takes time. It doesn't happen overnight. You're testing them and they're testing you to make sure that it's the right fix. But Trevor, answer this for me. Did you ever expect you'd be in a situation where you were filing for unemployment?
No. I thought my wife would file for unemployment before I did.
Yeah.
And that did not happen.
Yeah. I mean, it's kind of interesting because I know you personally, and you're a farm kid who's been working, since he was 10, every day of the week. And so to get to that point, it's got to be, an interesting situation that one was not faced with before. Mm-hmm. And Rob, regarding the staff again in your office, is the staff taking any training during this time at all? Or are you providing any training, or right now are you just, waiting till you get a little bit closer to relaunching the office?
For the first few weeks, I was doing the government alphabet soup. So I was kind of involved with that, trying to get my government cheddar. And now everything that we're doing for this month will be going over standard operating procedure for the new normal and making sure that everybody's on board with that.
Yeah.
So that's really where our training's been. My staff have been with me for a while. We do a lot of ortho-k, and they're fairly well indoctrinated into what they need to do for that.
Yeah. Okay. So if I could build upon that, in the new world, How do you perceive that the application and removal process is going to take place as the staff members are teaching the patients? I mean, will they one be masked? They both be masked? You know, how are you going to handle it? You know, DMV removers are going to be thrown away after they're used once. Have you gotten to that point yet of figuring that out?
Are you asking me?
Yes.
Oh, okay. Our plan is to have everybody that walks into the office wearing a mask. If they don't have one, we'll have one for them. And we're going to be limiting flow through the office to one parent and one child at a time. And when it comes to INR, we're going to have the patient not just wash their hands, but also their face. And that way, if they've been touching their nose, touching their mouth, touching their eyes, that part is now clean. Just like surgeons walk around like this, we're going to have people walking through the office to the INR room just like that.
Yeah.
And, you know, we're going to treat it as a clean field in that room.
Right. Right. And then as far as lens removal, do you use a suction device? Do you have your staff teach removal with that, or do you just have them manipulate with fingers for ortho-k?
We tend to lean towards digital removal because in the 20 years I've been doing ortho-k, I've yet to have anybody lose one of these. If they're going to lose a DMV, it's going to be on a Sunday morning at 7 a.m.,
Okay.
in which case I'm getting a call. So we give parents DMVs in case, or suction cups in case they need to help the child out.
Okay.
So a little bit of each in that way.
All right. Trevor, do you perceive this part of it, this part is training with the staff members to patients when they're picking up their lenses, is it going to be handled any differently than Dr. Gerowitz just said?
Not much differently. Probably the biggest difference with our office is we have a insertion and removal training area, but right now we've got like 11 exam rooms, and so we're just putting patients in exam rooms, because then we've got our cleaning technique afterwards where we try to sterilize the room afterwards. So we want to limit exposure out in there in just the office in general. So we're putting everyone in specific rooms. So we'll probably be doing most of the training and insertion in exam rooms instead.
And as far as your staff, have they been taking any additional academic-like training? I know I've talked to some people where they're having their staff take certification tests or those kinds of things to use some of this time for them to educate themselves even more.
Yep. So especially right now, since we've all come back as of Thursday, where we're all working hourly, they have us doing other training since we can't be in the office 40 hours a week, all of us. We have different training that our staff are doing. We're also taking this time, we had been tossing back and forth the idea of switching practice management software. And we said there's probably no better time than right now than to switch over. So we're switching practice management software with our downtime. And so right now we are learning all the new ins and outs of this new practice management software so that when we come back, we just can run with it pretty easily.
Yeah, yeah. Okay, that's terrific. So I'm going to jump around here just a little bit. I want to make sure that we cover everything. And if I can with you, Dr. Gerowitz, so, how are you and the family getting along, all locked up like the rest of us? I mean, have you been using this time for, academic things, family things? How are you spending your day?
My mornings are pretty much handled communicating with patients, doing telemedicine, and getting everything set up. Our kids are grown, so they're out of the house. And so fortunately, there's 2 levels to our house. And so my wife and I are not, nose to nose 24/7.
Yeah.
And I think that's important to give each other space. For myself, I probably have done enough of these Zoom meetings and webinars that if they were for licensure accreditation, I'd probably have my license handled for the next 2 to 4 years, because that takes a lot of time during the course of our day. That's the training I'm doing. And I've just submitted all my paperwork for my scleral lens fellowship.
Oh, terrific, terrific. So you're really using the time wisely, and you know, nobody ever gets a couple of weeks to do anything. If you take time off for 2 weeks and go on vacation, you're totally busy, you know, 18 hours a day there too. You don't really have time to do things. So, Trevor, and are you guys doing about the same?
Yeah, I've been, so I just completed my Scleral Lens Society Fellowship, so I just got that taken care of. And then I've been writing some articles, working on some different lectures that I want to submit, as well as we have 2 dogs, so they get lots of walks during this time. And then just been enjoying, the nice weather is kind of rolling in up here, so I've been enjoying the weather when I can outside. But yeah, otherwise, logging in on different speakers and things like that online, enjoying some of those talks as well.
Yeah, yeah. So if I can then switch back to the office for just a second, and Dr. Gerowitz, as you're going through planning coming up, you know, for reentry, right? So like you said, maybe end of May, maybe June, you're still not exactly sure. And then start projecting that out. Do you actually financially project month by month where you think you're going to be at? And the second part of that question, what I'm leading up to, is in a world of annual eye exams, what happens next March, April, and May when there aren't annual eye exams rolling in because they weren't there this time? And, you know, do we get to a point where everything's going great and then all of a sudden we get to the first quarter and second quarter of next year and it's like the bottom fell out again?
You know, I'd like to think that I'll be busy once I get back. There's no way to know.
Mhm.
I don't think anybody has a crystal ball for that. They hope to be busy, but who knows? And in terms of um, next spring, what I probably will do, you know, about 60 to 65% of our practice income is ortho-k. And we normally do 12-month maintenance programs. I may throttle those back this summer to 9-month programs, prorated appropriately, and have patients that are coming in immediately that were overdue come in next spring. That's just a thought I'm
Wow,
kicking around.
I haven't heard that one before. That's a great tip. You know, that, and, you know, patients, it won't matter, especially if you actually prorate what the fees are. It's a zero-sum game for the patient, yet it benefits you and the practice and then gets the patient back into this annual rotation. That could be the tip of the day. Very good.
Thank you.
So, Trevor, do you guys project any differences there? Or maybe your new practice management software will predict that for you?
Hopefully it will. So, but no, I mean, right now, I mean, I kind of imagine, you know, like I said, our schedule is already pretty full for the days that we do have schedules open. I was looking ahead a couple of weeks, and I mean, just about every slot is full or could be full by just moving patients around on that day. So I imagine, you know, we're going to be having to push patients out. So, you know, patients that wanted to be seen in March are probably going to end up being seen in May, and April is going to be seen in June. So I think it's going to kind of work itself out. Everyone's just going to get pushed back. You know,
Right.
rather than being seen a year from 2019, they're going to be seen 14 months from 2019
Right.
when they were seen. And so after a year, it'll kind of level itself out is kind of what I imagine will happen. So.
Right. So one of the factors there, of course, for Dr. Gerowitz, because of, you know, that large percentage of ortho-k, maybe or maybe not covered by insurance so much, but the other part of the practice, if it's insurance driven, the rules for insurance visits might impact what that rotation is and how often the patients can actually return to the office. I am curious about another thing, and Trevor, I'll ask you this first. Have you been taking any online CE?
I've been doing a little bit. Yeah.
Okay. Okay. So my question is, and if you're just taking a little bit, maybe it's not that a major of a deal, is I'm curious if taking online CE today is going to affect the way you go to programs and conferences and symposiums later on, because you already have a handful of CE credits in your hands.
Yeah, I mean, for me, going to meetings is more about networking and seeing people. So I usually have to get most of my CE credit for renewing my license via online stuff anyway, because I don't make it to too many of the lectures when I'm at the meetings.
Yeah.
So for me, that's not going to be too much different, I don't think. But
Okay. And I'm glad you brought that part up about attending the CE hours at the conference and saved me from pointing that out to you. Dr. Gerowitz, what do you think? Is that
Well,
going to change anything for you as far as the conferences you go to?
we'll probably be Mission Myopia Management will probably be doing fewer live in-person meetings.
Yep.
And I don't know of too many meetings that are going to happen in general for the rest of this calendar year. I
Yeah.
could be wrong, but I don't think so. Getting back to the insurance thing, if I can,
Sure.
as a policy, we don't bill medical insurance and we don't bill vision plans for ortho-k. So, and our patients know that going in. So I think that shouldn't be an issue. And I'd encourage other people doing ortho-k not to bill third-party
Yeah.
plans either.
Yeah. You know, for this kind of special treatment, you can see where that makes a lot of sense to be able to set it up in exactly that manner. So I'd like to stay with you for just 1 second. So I like to ask each of the guests that we've had on this series items related to this, but when you reopen, what is going to be the #1 major change that you will have put in place compared to 2 months ago?
For me, it's going to be staff PPE. You know, they're going to be wearing specific clothing that'll be washed every day.
Mhm.
They'll be wearing eye protection. They'll be wearing face masks. This is the part that scares me more than anything else. It just takes one patient coming in with active COVID
Yeah,
to put you back behind the 8 ball for 2 more
yeah,
weeks or worse.
yeah. I know that in fact, we've talked to some people who have, you know, especially multi practitioner offices where they're trying to split up in teams and see patients in teams. So if somebody gets sick, it's only a team that goes down, not the whole office that goes down, and they can still keep on going. And Trevor, how about you? Is there a #1 change that you plan on making?
other than our practice management software, we have basically broken up to, or we're planning on breaking up into teams, kind of like what you were saying, so that it's, you know, you're working with similar or same people kind of each day that you're in the office that way. And we do have the personal protective equipment available for all of our staff too, if they want it. I don't think right now we're requiring them to wear it. And right now we haven't had many patients coming into the office, but that might change in a couple of weeks, since right now we just have the emergency patients.
Okay. Okay, great. And then one last question. Both you guys have a tremendous amount of interest in ortho-k. You're at different stages of your career, you know, where Trevor, I know you've had an interest in this field as, you know, many years as I've known you, since you were a pup at MCO. And have maintained that interest. Do you have one tip that you could share with our audience regarding ortho-k going forward, whether it be communicating with patients, talking with parents, the fitting process, anything at all?
I feel like my biggest tip that I always give for people on this, you know, goes with ortho-k as well as with any type of specialty lens that I work with, is, you know, working with finding a lab that you work well with and the consultants that you work well with, and really utilizing them. I feel, you know, I've learned more from consultants than I did, you know, during my residency, or almost, you know, during my time at MCO. You know, I've learned a lot more from them about their specific products, and it's made me better at that, using those products than I could have on my own, for sure. So.
Yeah. Okay. That's excellent. I mean, it really is. I think consultants, they've played a big role throughout my whole career. I mean, anybody fitting contact lenses has no qualms about calling a consultant for advice, because they know so much more about the product and the process, and it's another head in the office for you. Dr. Gerowitz?
Well, I think that we have to keep in mind, especially during this time frame, that kids are spending a lot of time like this on their technology, and myopia doesn't sleep. It keeps going, it keeps
Mhm.
progressing. So I'm not intending to change my myopia management message at all,
Yeah,
except that we may do a few less follow-up visits and be more efficient in how we're doing those.
yeah. Okay. Yeah, the last quick question we had it from the audience that wanted to know, uh, do you foresee that you're going to interact with industry salespeople any different going forward than you do today? Meaning, of course, your favorite sales reps would come into the office, they'd see you, you'd hang out with them, you'd learn stuff. Is there going to be a protocol now in the office for interacting with industry representatives? And if you've thought that far ahead, what would be your tips there?
Mhm.
I
So I can take
Go
this
ahead.
one first if that's so.
Sure.
We already have a protocol for our sales reps. They have to schedule an appointment to meet with whichever doctor they want to meet with. We don't. It just really throws a kink in. We can't guarantee that the doctor will be available if they just show up randomly. So they always have to schedule an appointment. And I meet with all the contact lens reps and consultants who come to the office, and so they know what day of the week I'm available, and they always just email me to schedule something, and I just put them on my schedule. So we're probably going to keep that the same. Most of the time, I'll probably just be communicating more with email, whereas a lot of them would check in at least once a quarter and stop by, if not, once a month, stop by the office. But I'm still open to having them stop by the office, but we'll probably go through a similar check-in where, we're checking temperature, hand washing, all these different things, making sure that, we have basically like a little conference room that we would go to with them, and it would just be in that
Yeah.
room, just kind of limit their exposure around the office.
Okay, that's great insight. Rob?
No, I think what Trevor said is spot on. We probably won't be seeing any reps for the foreseeable future through the summer. You have to keep in mind if
Mhm.
they're going into offices, just like frontliners, they're exposed to everything. And
Right.
I don't mean to sound so paranoid in this conversation, but you have to take proper precautions. So we'll probably wait until the fall before we start having them come in by appointment.
Okay. So
Mhm.
just building on that, since Zoom has taken over our worlds in the last 2 months, would you find it appropriate uh, to have a scheduled Zoom visit, if you will, with a sales representative, and neither one of you have to be face to face, even though we are very face to face right now. It's kind of the same thing, to be able to have that chat with them.
Absolutely. I think I can't remember a time when we didn't have Zoom, though it seems like all of a sudden it was there. So I think Craig, that's your management tip for the day. I think that's great.
Thanks. I've been trying to get one for the last 2 weeks, so I finally got one. That's terrific. Trevor, what do you think?
I agree. I think, whether it be Zoom or some of these other virtual platforms, I believe, we're going to be utilizing those quite a bit, especially, if someone's got something new that's coming out. Oftentimes when reps come in, it's usually just, kind of some of the same old stuff that I've talked about 6 times, and that's where it's, email will be perfectly fine. But if they've got a new product coming out and I want to learn a little bit more about them, having them actually walk me through some of that stuff where, you can do a slideshow with it or something will be beneficial.
Yeah, yeah. I think that will definitely change for, the industry representatives also, to figure out the best way to communicate. And,
Mhm.
these kinds of things, I think are going to be a big deal going forward. So, hey, fellas, I really want to thank you for today. This has been really very interesting, very informative. Two contact lens people at different stages of their practice, but really very insightful. Dr. Rob Gerowitz, thank you so much for your time today.
My pleasure. Thank you.
Dr. Trevor Fosso, Trevor, again, thank you so much for your time, and thank you to everybody for taking time out of your schedule to listen to a few tips of being home alone and managing patients, their parents, staff members, and yourself. Thank you very much, and have a good day.